More than a quarter of Wisconsin's population is at least in the process of getting vaccinated. Nearly 1.5 million people have received a first dose of the COVID-19 vaccine. Also, nearly 15% of people in the state are considered fully vaccinated. Good evening, I'm George Smith.
And I'm Jennifer Cleese in for Amber tonight. Those new vaccination numbers from the Department of Health Services come as millions more people are now eligible to be vaccinated. State health officials estimate 2 million people have certain medical conditions who are now able to get the vaccine. Some of those conditions include cancer, diabetes, heart, liver, and kidney disease, obesity, and pregnancy. We have a full list on WKOW.com. With such a large group becoming eligible for the vaccine, some healthcare providers are tackling the challenge of prioritizing more high-risk groups, but still getting those vaccines out.
Francisco Almanar has got you covered on how hospitals are making the decisions.
People with pre-existing conditions are now eligible to get vaccinated wherever they can find an appointment.
You know, if you were a little bit behind the 8 ball or slow to get vaccinated as a 1B, as of today, it just got a little bit harder because now you're actually competing with the next group of people.
Dr. Jeff Potoff with UW Health says with larger eligibility groups, priorities change.
I do think that transition is happening between prioritization based on likelihood of severe disease versus making sure we have enough people so that we are giving vaccine when we have vaccine and not saving it for people who may or may not decide to get vaccinated who are in those higher risk groups.
At UW Health, they've already sent out invitations to their 65 and up population to get their vaccine appointments set up. But from now on, all other groups will have to make their own appointments.
Dr. Potoff says the new system is very much like what you would expect here at Walgreens, and he expects it to be the norm as larger groups open up. He says it just makes much more sense to do it this way and get more vaccines in arms.
The amount of work and time it would take to dig that out and develop a system where we could strategically pick people with, say, the most conditions to the least conditions just doesn't make sense because we'd be spending all our resources in figuring out who to vaccinate.
Depending on the hospital provider, the situation is very different. At Unity Point Health Meriter, they're still sending out invitations, prioritizing their primary care patients in vulnerable populations or with comorbidities and high risk factors. And SSM Health is doing a hybrid, still sending out invitations to their patients online while providing a number for people to call to get their own vaccine. In Madison, Francisco Almenara, 27 News.